Good evening and welcome to Monday Night Live. Let us begin with a word of prayer. Our Heavenly Father, we give you thanks for this day and ask for your continued grace to be with us now in our discussion. This is our prayer in Jesus' name. Amen. So we're looking at a very important topic. What stole my mind or what stole my memory? And we're looking closely at Alzheimer's disease. Could it be Alzheimer's that is this new form of dementia? Many people would know of dementia, and Alzheimer's is just one type of dementia where you're losing your memory and not able to function as well as you used to. So let's take a look at this. I'm speaking to you from Pure Wellness Lifestyle Center, located all the way in Trinidad and Tobago. And here we have our residential programs that are hosted several times during the year. On our website, you can get more details about the dates and get details about the activities that are conducted at the center. Of course, please feel free to connect with me, any of the team members, should you see the numbers showing up, and get information as to how best we can help you and serve you. It's always an experience when you do come out to the center. It's very much unique. And we had some folks over the weekend celebrating birthday and giving God thanks and just staying with us here at the center. And of course, the experience was a rewarding one. So a disclaimer, I've not really put disclaimers up, but today and hopefully in the forthcoming sessions, it's simply to let everyone know that the presentations is not intended to diagnose, treat, cure, or prevent any disease. There's information shared on lifestyle natural remedies, herbs, and supplements. They are based on current research, health principles, and professional practice. Individuals should consult their qualified healthcare provider before making changes to diet, lifestyle, or medications, especially those with pre-existing conditions or who are using prescribed drugs. Speak to your doctor before making changes. There's some drug medication that you just cannot stop, or it's not advised that you stop cold turkey. You may need to wean yourself off that and having careful monitoring to do just that. So we're not providing that kind of care to you. Your primary healthcare provider is doing that. They would see your labs. They can send you for further testing to prove that all what you're doing with your lifestyle interventions are great for you. Even before you start, you can share that with your doctor, and they very many times would support, because they do know that diet and lifestyle plays a huge role in disease treatment as well as improved outcomes. So our topic of discussion, let's look at some lifestyle interventions for Alzheimer's. Now, big question, what is Alzheimer's disease? What is it? And Alzheimer's disease is the most common form of dementia. It accounts for 60 to 80% of all dementia cases. So it's a huge chunk of individuals with dementia that could look at the diagnosis as being Alzheimer. It is a progressive, and let's score that word, it progresses. It's a progressive neurodegenerative disorder that causes our brain cells to shrink and to die. The result is a gradual decline in memory, in thinking, behavior, in the ability to perform daily activities. So the disease typically develops after the age of 65, but you also have an early onset Alzheimer's that can appear in individuals in their 40s or 50s. Is that your age bracket? Is it mine? could we be at risk for early onset Alzheimer's? This is just a little diagram here showing you of what a healthy brain looks like and what an Alzheimer brain looks like. Look at the spaces. Look at the heavy line measured out on everywhere. It's really thick. You know, it's not nice and light. Look at the big space here. What is that saying? Brain cells have died and the brain is getting smaller and smaller, and certain areas that would of the brain that would have been responsible for maybe your memory, maybe for recognition of individuals and so forth, all of that is gone. So this is pretty serious. That's what we're looking at. Look at the space here. It wasn't there before, you know, in this massive way. So when you see that happening, it's progressive. Note it progresses over time. Where did the name come from? Dr. Louis Alzheimer in the year 1906. He saw changes in a woman's brain tissue. She experienced memory loss, language problems, not able to express herself well, and unpredictable behavior. And after she died and they did an autopsy to inspect the brain, they noticed that it had abnormal clumps that you would call amyloid plaque in that brain. And, you know, or fibrous tissue called tangles. So in the brain was pretty much surprisingly different. So what could have caused that lady to get Alzheimer's or anyone else to get Alzheimer's? We have a couple of considerations. One, well, just structurally, you have existing in your brain amyloid plaque. It's abnormal buildup of beta amyloid protein fragments between the brain cells, and it interferes with communication, how you connect with others and communicate to them. You also have tau tangles, which are twisted strands of the tau protein structures that exist within the neurons, and they lead to cellular damage. So you've got a buildup of this protein compound, and you also have some misfolding or twists and turns of protein formation that is abnormal in the brain, and that can lead to poor brain function. Genetically, you may be inclined, you may have a gene APOE E4 or ApoE4. That is a gene that is highly associated with Alzheimer's disease. It can put you at risk for getting Alzheimer's disease. You don't have to. You may express the gene, but or possess the gene, but it's not expressed in an Alzheimer way. Notice that you may have that gene, but it doesn't mean to say you would get Alzheimer's. You may be likely to suffer from cardiovascular disease, where you have the plaque deposits inside of your arteries. So the plaque deposits inside of the arteries, the plaque deposits on the brain cells are very much similar. Therefore, what can help you to reduce the buildup of those plaque deposits in the arteries can also help with the brain, and we'll show you what are some of those items. And therefore, testing. If you have someone, a parent with Alzheimer's, you are likely that you may have it. You can go test and see how high that incidence is. And even if you see it positive, then the steps that we are going to be sharing here tonight can help you to delay the onset of the Alzheimer in your brain. And that is possible because that's one of the approach to the treatment is to delay the onset. Another factor to look at is hearing loss. Now, you may experience hearing loss for some reason, but by that part of the brain not being stimulated because you're not hearing, then you're likely to have Alzheimer's. It's an increased risk of getting Alzheimer's disease when you lose your hearing. If you need to wear a hearing aid, then please do, because it could delay the onset of Alzheimer's. There are other medical conditions, untreated depression, loneliness, sedentary lifestyle. All of those can be the early stages for development of Alzheimer's. So cardiovascular risk, where you have high blood pressure, that tends to shrink the brain cells, affecting the brain. And then you find the cognitive decline. Diabetes can put you at risk. Obesity. Let us not be comfortable in our overweight. Let us do something urgently about obesity because it puts us at risk for so many health challenges. And you can simply start by drinking more water. You can simply start by ensuring that you walk early morning for at least 60 minutes. If you started right there, it's going to make a difference for you. You can start by making a change to your diet and get your weight shedded. We're looking also at smoking. It increases our risk. High cholesterol levels can increase your risk for these amyloid plaque development in the brain. So if your cholesterol level is high, don't be comfortable with that. Not only heart disease, but note that it can impact and develop Alzheimer's later on in life. Okay, so some individuals have diabetes type 2, and it lingers with them long enough, the same inflammatory factors that's triggering the diabetes can also develop into Alzheimer's. It's what you'll call like diabetes type 3 is noted to be an Alzheimer's state. Chronic stress. Chronic stress. That's not life for us, for human beings to live in stress continuously day after day after day. Poor sleep, lack of physical activity, poor diet, social isolation increases our risk. Brain injuries or exposures to toxins, chemicals, pesticides, all these things hurt our neurons, and they put us at risk. What about the age? Advanced aging is the greatest risk factor because the longer you live, and if you have some of these other risk factors, then you're likely to develop Alzheimer's. And women are more commonly affected, partly due to because they live longer, so they got to see the disease develop in them, and possibly having some hormonal influences as they age. Brain areas critical for memory, especially the hippocampus, are affected early, causing initial symptoms. But just to let you know that the cells in the hippocampus can regenerate. And walking is one area that can help in regeneration of those neurons. So these are some of the risk factors. So what are the symptoms? How would we, start thinking, well, we need to go do some checkup. What are we looking for that might flag the mind? So let's say we have memory problems, individuals putting things down, not recalling where they put them down, and it's happening too frequent for comfort. Reasoning, the way in which the thoughts are processed is very unusual for the individual. And then language, not able to conduct a proper conversation, always like searching for words or starting a sentence and not completing it because the person is just at a loss for words. And this is unusual for them. Coordination, unable to tie a shoelace in. Used to be able to do that, and then now you can't. And mood, just a lot of mood swings, aggression, or irritable mood. Behaviors, the strange, just walking off, walking away. You're supposed to be here, but then you're just heading out the road. Where? Why? And you're giving some story that it doesn't make sense. Okay. So then on the other side here, we have some warning signs. So the memory loss that disrupts the daily life, trouble with visual images and spatial relations, difficulty completing a task. Okay, new problems with words in speaking or in writing. Notice that it is new. It's not something that had been common for the person before. Changes in their mood and their personality, misplacing things, and not being able to retrace their steps to find it. Decreased or poor judgment, withdrawal from work, not going to work, absenting yourself, leaving home but not getting there, and withdrawal from social activities. You're just not connecting with individuals anymore. Confusion with time or place, and challenges in planning or solving problems. If a simple task that you would have been able to do with ease is now quite difficult and challenging or just not coming. So there are different stages. You have mild, we have moderate, and then we have severe. And just a quick look at if you are in a mild or the early stage, you have a memory lapse, forgetting names, recent events. Now, many of us forget names, okay? But you're trying really hard for the name of your auntie and you can't remember your aunt's name. Not for anything. All right, so that's serious. Recent events, you didn't remember you went to church on Sabbath, or difficulty finding words or picking up with a conversation. Now, notice that these may be symptoms for other conditions, not only Alzheimer's, but at least it's causing us to think and to possibly follow through with further investigation. Trouble managing finances or even planning, misplacing items more frequent, and subtle changes in the moods and personality. And so a moderate stage or the middle stage is where you have an increased memory loss. It's like getting worse. And you have difficulty even recognizing friends and family. Have you heard about that? Man doesn't recognize his wife and asking her, "Who are you?" And that happens. And that is real. Woman doesn't recognize her children. And that is real. So the problems again with language, with reading, with writing, they are wandering now, just walking off, getting lost, even in familiar places, can't make their way back home. And it's worse if the person is driving and they just drive to some far distance and can't find their way back home, and they can't even tell you on the phone where they are. Behavioral changes, agitation, suspicious about everything, repetitive actions, and then sleep disturbances. Now, here, you got a lot of folks having sleep disturbances. Could it be that there's some structural decline in your brain cells? So many times we say we cannot sleep and we think, well, the chamomile tea is going to help. Good, let's rule out all of that. But if it still continues, then we may need to look deeper. Again, always look for the root cause when you see these symptoms, these conditions. Always look for the root cause, not just to cover it up. And the severe stage, a late stage of Alzheimer's, will be loss of ability to communicate coherently. You're not following, you're not making sense. The person can't really carry on a conversation. And you got to be so patient with them because that's the new them. And you knew them to be better, be able to carry on a conversation. So exercise patience, tolerance for such individuals. Just work along with them at their level for what they may be able to do. Don't seek to task them with any responsibility that they are incapable of carrying out. Because that would frustrate them and it will frustrate you, and your response to them is going to be quite irritated. So let's exercise patience. So dependence on others for daily care, whether individuals now need you to help them with eating, or else they just won't eat all the food, to help them with dressing, individuals who are going out and you say, okay, let's go, we're going to the mall, and they put on a nightgown. They need help with dressing, and help with personal hygiene, just to bathe. You'd send them to bathe and they put a shower on, but they're not in the shower. And they come back out, all powdered up. So you gotta watch closely and just work with them. It's like once a man, twice a child. Loss of mobility, difficulty swallowing, that can be challenging because now they can't get food intake well, and then that's going to decrease nutrition. Severe weight loss, vulnerability to infections, and especially pneumonia. So that's a late stage, advanced stage of Alzheimer's, and it can mean care and watch 24/7 for that individual. You got to be very consistent with the support because any lapse in it, they're off your hands. They go running off and they're out of your watch. So you have to be consistent, just keeping them close. Sometimes you may go walking together and they run off, leaving you behind. So you just have to have close grip on them. And then the importance of the of lifestyle interventions. Let's look at that. So you have pharmacological treatments. They have limited efficiency. So what would be said? No cure for Alzheimer's, and let's work on sedating the person. That is just like, outing some fire, but it's going to fuel back up because the source has not been quenched. And so let's look at the lifestyle factors. Even if they are in the care of a primary physician, there are certain things that you can do for the person or with them that will be helpful. Again, it can delay the progression. It can delay the onset of and give them a better quality of life. So physical exercise, healthy diet, cognitive stimulation, social engagement, and avoidance of smoking and the excessive alcohol consumption as some of the key factors. And we look at them individually. So when we think about physical activity, you're looking for at least 30 minutes a day of physical activity, movement, and this is structured, planned movement, such as walking, that happens every single day. And it's not enough for us to have this exercise 3 times a week. You need to have it every single day. From the time you see the onset of the memory issues, every day. Ask the person, go walk. You go walking with that individual. And then you want to understand that exercise promotes brain plasticity, which helps to improve the memory. So as the brain starts to be activated again, to work well again, that's what you want. Exercise tends to reduce inflammation in the body and improves cardiovascular health. So not only are you addressing the brain, but also your heart health, improving blood circulation throughout the entire body. It's also associated with reduced risk and slower cognitive decline in Alzheimer's people. So you are looking at exercise as being paramount in their care and in the intervention. Let's look at dietary interventions. A diet rich in antioxidants and omega-3 fatty acids. Where do we get those? In your leafy greens, in your herbal seasoning items for massive amounts of antioxidants. You're looking at included in your food preparation, things like thyme, oregano, basil, sage, rosemary. Hugely important to add in our meal preparation, add that. And we will also, because you have the Alzheimer's state, is to separately take it in the forms of teas or in capsule. Let's look out for berries. They, again, great in antioxidants. Our nuts, seeds helps with the brain, and nuts such as walnuts, almond nuts are excellent as well. Whole grains, eaten whole. Olives, so that you get the varied types of EPA and so forth in your olives. Now, studies show adherence correlates with slower cognitive decline and reduced Alzheimer's risk when adhered to consistently. So it's not just that you're trying this out for a week. The studies that show that you delay the progression of Alzheimer's disease, the studies that have been proven to prevent the onset of Alzheimer's disease indicates that we need to have consistent dietary interventions. What does that mean? Every day, we eat foods that will nourish the brain. Every day, we exercise. We keep physically fit, physically active. Every day, we do some of the other lifestyle interventions. It's every day. It's a way of life to live that will help us to prevent, treat, and even reverse some of these challenges. So when we're looking even at Alzheimer's, and I mentioned earlier that some of these neurons can regenerate, then if they're coming, let them come back healthy, as opposed to come back in a poor state. And so the internal environment is hugely important. Reducing inflammation in the brain is hugely important. And having these food nourishing items in our diet is important. Our social connection is amazing in that instead, if you watch, one of the symptoms of individuals with Alzheimer's is that they isolate themselves. They stop connecting with people. Let us include them rather than say they're not 100% coherent in the conversation and so forth. But rather than exclude, let us include these individuals and do activities that they can participate in. Just catching a ball or holding hands and skipping or something. It's not that they are disabled. So rather than just leaving people to themselves, seek to be a friend, seek to be a great family member and include them in our connection. As a matter of fact, when you think about the risks that you may have because of genetics, because of your toxic exposures, because you're already beginning to see some early signs, rather than just do nothing, let's make sure we keep connected with people. And you can read together, study together, do activities together. You may be in school or you may be in church, and just simply doing a Bible study in a group, face to face, even better, can help you to protect that brain. God has created so many avenues, especially within the congregation of believers, to support health and wellness. And so instead of them being grumpy and sad, they can now be happy. Their mood can improve. Activities such as reading, puzzles, and learning new skills encourage that for them. Give them a puzzle book. And however they circle, whatever they do, at least they're doing something. And again, it's repetition. And if they got it right, we need to repeat every day. Have them read aloud for you. You see the decline coming on. And this can even be on an individual basis, that if in the early stages, you can drive yourself. Not always do we need others to drive us. So if you're still capable of driving yourself, to read every day and read aloud every day, at least 15 minutes, or do puzzles every day, just do it. Especially as we're aging, it helps to stimulate the brain to just keep it working well. And then, again, notice combined cognitive and social stimulation may slow the progression of early Alzheimer's. So it's not just you're doing this in your home, you're reading and your puzzles and learning new skills alone, but when you come out and you interact, so every part of connecting helps. So the combined effort, engaging with others, can help in slowing the progression. Avoid these risk factors such as alcohol and smoking. You find that smoking tends to increase oxidative damage to our cells, and thereby the cell's DNA is impacted and Alzheimer's state can come sooner. So smokers are at risk, and those drinking a lot of alcohol. Alcohol damages the brain cells. You know what's that? That your brain cell is damaged. It's broken. It's not going to come back just like that. So when it doesn't work, then you're losing brain cell, you're losing brain mass, your brain is shrinking. So what should we do? Cease from the smoking and the alcohol drinking. Make that change. And the evidence from clinical trials show that intensive lifestyle modifications, they demonstrate improved cognition in early stage Alzheimer's. So it is intensive. It's not just a mild approach to making changes and these lifestyle changes and dietary changes. It is really keeping up with it in an intentional way and being consistent with it. Trials emphasize, what are we looking for? Changes with the diet, exercise, stress management. Just tell yourself you cannot handle stress and leave those stress matters alone. You know, individuals, if you think that stress will help you, it doesn't fix your problem. And if you were to drop down and die because you're stressed so much, this situation still exists without you. So exercise some self-care here and let us leave the stress alone, find different ways to cope. It might be personal. It might be something that's touching you, hurting you. But at the same time, how much of your life are you going to throw away? So let us find different approaches to handle stress. And we have done several stress topics in our previous Monday Night Live sessions. So you can go to look for them on the YouTube and get some more details there on strategies that you could incorporate. And let's focus on the social support. So again, a combined approach is important. We are combining. It's not just about making a change to your diet and your sedentary lifestyle. No, we gotta have this combined approach. Get up to mark with your diet, with your exercise, with your happiness. Let's use something a little bit more positive, not stress, but happiness, and even a social connection. And together, that's going to help to improve our desired outcome. Personalized plans can be helpful, and potential to reduce Alzheimer's risk when we have this combined effort is reduced by up to 60%. So is there hope for someone with early onset Alzheimer's? Yes, there is. Is there hope for someone with middle stage or even end stage? Let us not give up, because as long as there is life, there is hope in the Lord that all things work together for his good, and it is possible. With him, all things are possible. So let us not give in to say the person is advanced. Let us do what we can, what we can encourage them to do, and a little bit can still account for something. And as time progresses, again, repetition, consistency, hugely important, a combined approach. And this has been proven by scientific data, by research on real individuals working with them over time. So when we think about the change to the diet, what are we looking for? Does it include fish? No. In the fish, you'll get your omegas, but it's not the only way. You can eat your algae. You can eat seaweed, such as sea moss. You can have spirulina, corella, your kelp. Those are different items that you can have added to your diet. You want to look for a total plant diet. You want to look for getting your leafy greens, your berries, your nuts, your legumes, your omega-3 in your flaxseed, chia seed, walnuts, and the weed items. So let's get those in. Why? Because they nourish the brain. They nourish the brain. And then avoid refined carbohydrates, the white flour. And or rather than go for flour item, go for the whole grain. Let's eat the oatmeal, the whole grain. Let's look for the whole rice as opposed to the white rice and so on. Processed foods that are made in the factory setting, processed through, those are not healthy foods to have. You want to have avoid the refined sugars and animal fats, the butter, the lard, all of those animal fats. You want to stay away from those things because they can increase the amyloid plaque in the brain. And then we talked about the exercise, strength training 3 to 5 times a week, but the exercise is every day. And that would help to increase the blood flow to the brain and increase neuroplasticity, the cells of the brain, for them to be more plastic, more absorbent of information that's coming to them. And restorative sleep is hugely important as well. You're looking for, look at this word, consistent bedtime and wake up time. That would give us anywhere like 7 to 8 hours of rest on a nightly basis, and maintaining that circadian rhythm in our body, the hormonal impact. So when we go to sleep in a dark, cool room for 7 to 8 hours at night, we need it. If we're getting less than that, we're putting our brain at risk for decline. And eliminate the blue light and noise at least 2 hours before sleeping, or even eliminate and avoid eating food 2 hours before your sleep. We talked about the stress. You don't want to, you want to first identify and reduce harmful stress. Let's identify what's stressing you, leave it alone. And daily prayer instead. Let's look for daily prayer, meditation, deep breathing, gratitude journal. Write something, even if it's one word of expression on a day-by-day basis. Again, you want that brain to be thinking. You want it to be stimulated. Why leave it alone? You can challenge yourself for improvement, and you're the only person with you every day. So if you recognize a little decline here and a little decline there, you're misplacing your keys too often, and you're putting it at the same place, but you just didn't remember it's the same place you've been putting it, then no, something is wrong. So you're the only person with you every moment and every day. So just have a habit that at the end of the day, you're going to write something. Just that helps to from brain to hand to words, and that helps. And daily prayer helps. Prayer changes things. Prayer calms the soul, the mind, and it makes that mind uplifted to heavenly thoughts and to a higher plane. And so let's look at Bible memorization, puzzles, music, meaningful community service. Again, engaging with others and doing something on a daily basis. So quickly, we'll want to incorporate certain agents to help with our improved brain function. And hydrotherapy, water can help to do that. You have contrast showers. What will hydrotherapy do? It will improve circulation and oxygen movement and relaxation and enhance the brain function. Okay, so if you did the 3 minutes hot, not to burn your skin, but as hot as you can bear, and 30 seconds cold, you do 3 cycles of that. It increases blood flow to the brain and reduces inflammation. Okay, you got that? So every day, let's do the contrast shower. 3 minutes hot, 30 seconds cold, 3 minutes hot, 30 seconds cold. One more, 3 minutes hot, 30 seconds cold. Then a cold compress on the forehead or the neck. It tends to calm that agitation. It tends to improve circulation, and you want to apply it for 5 to 10 minutes. So what's a cold compress? You can take a towel, get a nice hand towel, you dip it into some ice cold water, a basin with water and ice cubes in it, and dip that towel in there. You get it all soaked up, and then you wring it out tight, so no water is dripping. It's all wrung out tightly, and you simply put that on your forehead, and it has cools down. Or you can put it on the back of your neck, and it just cools down. And that can help for if you left it there for about 5 to 10 minutes, it can help to improve circulation. Okay, so question, whether we need to wet the hair in a contrast shower? Not necessarily. You can put on a shower cap and do it. Okay. Another water treatment is the hot foot bath, and this is what I would say simply, it's a hot soak, a hot foot soak. And so it tends to draw blood to your feet and reduce brain congestion if you have too much blood in the brain because of too much activity, or just congested brain, especially for someone who's challenged with their memory, just even carrying on a conversation could be hard for them because they're trying to recall words and that sort of thing. So you can just simply put them to sit, put their feet in some nice hot water and calm them down, get that body relaxed. That can help to improve their sleep. And you keep that feet in that water, keep the temperature nice and hot, sufficient that they could recognize they can take it, not overly hot, because suppose they cannot express themselves that this is too hot. You don't want to burn their feet. So you feel it nice, warm. And even if it's warm, it's just calming for about 15, 20 minutes. And then you have a full body cold mitten friction. Daily in the morning time, you want to have a rub, but from cold. Again, take your towel. It could be a hand towel or a rag. Get a basin, put some ice cubes in that, stir it around, the water becomes cold. You then take your little rag, you dip it in the water, soak it up nice. You squeeze it out, squeeze out the water, squeeze it out. Now you shake that towel and then you take it and you just like rub the skin from the hand coming upward the shoulder. Rub it up and down quickly. Up. Then you can do your neck, do your face, do it to the back of you, to the front of you. Dip that towel again, squeeze it, squeeze the cold. But you're doing a whole body rub on yourself or for someone. And that can help to stimulate circulation, can help to stimulate mental clarity. It feels really good, especially if the morning is warm. But in the morning, good set off for the day. And then let's look at something. These herbs, are there any leaves for the healing of the brain, even in Alzheimer's? Ginkgo biloba, that helps to increase the circulation of blood in the brain to help improve memory. If you notice the leaf of the ginkgo biloba, it's shaped like a brain. Yeah. It on either side, the leaf itself has the little jagged finish, just like the brain. That is a nice tea to drink for the brain to help to improve circulation and memory. You can even use it in a supplemental form in a capsule. So look for it and follow the standard extract, anywhere 120 to 240 milligrams. Then coca-cola is another that helps with the nerve regeneration and brain health. So there you got two: ginkgo biloba, coca-cola, sage, turmeric, rosemary. These need to show up in our food preparation every single day. Better yet, we can make a tea that includes sage. And because of the intensity of the condition, let's get a good, nice intake of that. You can get the sage capsules and these items and just open much, see how they dose recommended on the bottle for the capsule, and you just open it up and drop it in some nice hot water, let it draw, and for about 30, 40 minutes, stir it around, strain and drink, or you can just swallow the contents if you can. So it gets into your system and it works nice for you. And the sage helps to increase the memory and concentration. Turmeric, potent anti-inflammatory. It reduces the amyloid plaque. So the amyloid plaque can be reduced. Yes, it can reduce the buildup. Best taken with the black pepper. Well, I don't like black pepper too much. You can do some ginger. Add some ginger to it, and that can help with increasing its intensity. But there are times when I would find and use the turmeric with the pepperine in a capsule form, and that helps nicely. Just that the black pepper can be quite irritating to the stomachs, especially for individuals who have stomach-related issues. So show some caution with that. But if you swallow the capsule, you'll feel better. Rosemary, again, it helps to stimulate alertness and memory. And rose memory, you hear? Rose memory. Don't forget that. So rosemary is a nice one. Add it to your food again and make a tea because of the intensity. You have a situation going on. Let's get a larger dose of this in the form of a tea. 1 teaspoon of sage, 1 teaspoon of turmeric, 1 teaspoon of rosemary. You can add that to about 4 cups of hot water and just draw that, and it can help. There are certain supplements that would be good. The omega-3 fatty acids that you can get from your seaweed vegetables, your flax seeds, your olives, and chia seeds, your walnuts. Then B complex, especially looking for in it having B12, B6, and folate, but you certainly will get that with any B complex. When you do the B complex, you get these nutrients, which are great for the brain. They reduce homocysteine, which is an enzyme that is linked to cognitive decline, and many times because of a B12 deficiency. So let's look for the B complex. You will get the range of the B vitamins, and they would support each other in its assimilation and availability to the body for all those essential B vitamins. Vitamin D, it's hugely important. It supports brain and immune health. And a deficiency is common in dementia individuals because they are indoors so long, or they're aged and they don't make vitamin D as well as they would have when younger. So vitamin D is important. Anywhere 5,000 to 10,000 international units will be beneficial. Magnesium, magnesium glycinate or magnesium threonate. It improves brain plasticity. It improves sleep. So it does have an impact on the brain. The coenzyme Q10 reduces oxidative stress in those cells, which make your cells, when they are hit by oxidative stress, they tend to be rusty. They don't function well, but coenzyme Q10 helps to maintain stability from a cellular standpoint for those cells in the brain. They're looking for that. ALA, alpha lipoic acid, it's an antioxidant supporting the mitochondria in the cell, keeping it active, keeping it sharp. And resveratrol, usually found in the red grapes, berries, but again, they support blood flow throughout the body and especially to the brain and to the heart. And they are rich in antioxidants, so they tend to reduce the oxidative damage in the cell, helping the cells to repair themselves nicely. And a probiotic comes in really helpful here as the gut and brain is connected. So why not have some good beneficial bacteria working for us? So this is another one that is really key. Here we have the nattokinase and serrapeptase. Nattokinase and serrapeptase, they work in breaking down abnormal protein accumulations, including amyloid plaque in experimental studies. So no harm. We've seen where this will break down fibrin and fibrous tissues in the body, in other places. So why not in the brain? It does help. And so you need to take it on an empty stomach, so ahead of a meal. But individuals who are on anticoagulants and like warfarin or blood thinners, you need to be cautious because this is also helping to thin the blood. So it may not be something that you could use if you're on medication for thinning the blood. And if you have peptic ulcers, again, you want to stay away from this one and any bleeding disorders. But generally, if you don't have any of those issues, it helps to improve circulation and immune function and break down the plaque deposits in the brain. That's going to be amazing for you. And our lemon garlic drink, This I'll also recommend. Again, if you're not on blood thinners, you'll be able to do this safely. And where you're taking 3 bulbs of garlic, 3 whole lemons, you're cutting it, just chop it up, skin, seed, everything. And you want to blend that or juice it to get its juice. So you're taking 2 cups of water. You can steam your garlic for about 5 minutes and then put it to blend. When you break your garlic, let it sit for about 20 minutes. Then you steam it 5 minutes. Then you can put it to blend in 2 cups of water. Put that on the side. On the other end, you take 2 cups of water, your 3 lemons, you cut it up, you blend, you strain it, you add it to the garlic. You can strain the garlic as well. And now you have your drink, and you're going to take 3 ounces 3 times a day. Okay, keep the rest remaining refrigerated so that you can come back and use it. This helps to break down the plaque deposits in the brain, in your arteries, and it helps to improve the circulation. And as prayer and scripture, we want to also look at when we pray, when we read the word of God, it tends to promote that peace and calm within the body. It helps us to improve in our coping mechanisms. Music is hugely important, and if you could sing, even better. But singing hymns that are uplifting, that are soothing, that has messages in it to keep. And if you're singing hymns, that means that you're recalling words. Yeah. And if you could recall words, that's excellent. That's just exercising and keeping the brain in good function. Now, purposeful living. This we want to do again. If we incorporate these activities, it's going to delay the progression of these cognitive decline and dementia, Alzheimer's. And so we want to have some meaningful activity and service in our lives to others on a day-by-day basis. So in conclusion, we're looking at engaging in aerobic strength building exercises. We're looking at adopting a total plant diet. We're looking at stimulating the brain, even with social connections. Let us not isolate ourselves. And as individuals get older, loneliness is real for them. Their friends are gone. And the children are far away, or the older ones whom they used to connect with, they're no more there. So seek to build the structures around you that will allow you to have these social connects. Avoid the tobacco, avoid the alcohol, and seek support for stress management. Our recipe of the week. Let's have a look. Our recipe of the week, it's our vegetable medley, I call it. So this one, actually, I'll tell you how to cook it. So you have onion, garlic, cilantro for your seasonings, basil. Let's put some turmeric and thyme in here even. And sage, you can have all of that. So what do? You put some water in your pot, you chop up your onions, you chop up your garlic, you put in your cilantro, your thyme, your oregano, your sage, your rosemary, just a little bit, not overly too much, you don't want it too powerful, a little small teaspoon, throw it in the pot, the water in there, you bring all of these to a boil, and that's your flavor. You put the pink Himalayan sea salt there too. Not too much because you have to taste as you go along. And once you have that prepared, you add in your cabbage. So your cabbage will be pretty tough for cooking. So let's add the cabbage in and let that cook nicely. Cover the pot, let it simmer. You may need to add some more water as you go along. Add hot water. So you always have a kettle running on the side with the water hot. And so you're going to add some hot water if you need to. You don't want it to dry down. You want to have a little sauce in between. And then the carrots. So in this case, I shredded the carrots. You scrub the skin, and then I just grated it. and throw that in. Cover it down, let it simmer nicely. And last thing, you have the bok choy, or some people say pak choy, or so that's green leafy, because remember we talked about enhancing cognitive function. We want green leafy vegetables. So we have the green leafy in here, and then so you chop it up nice, small. You chop up the green leafy small, and you add it to your cooked cabbage slash carrots together, and cover it down. Again, you don't want it to be too dry. Add a little water if you need to. You cover it down, let it simmer for about 5 minutes. Turn the heat down so that you get the simmering effect, the nice slow cooking effect. So things can come in and start getting the flavors on the food. Taste to see if you need a little bit more salt. If you're good, then fine. And then you switch off and keep it covered. So the steam will continue cooking the item, and it'll be quite nice and ready for you when you're ready to eat. It's delicious. So try that out. You can add other things to this. You can put celery in there as well, and it'll be nice. That's how I did it on the plate. You put up your lettuce. This is quinoa and some peas. Scripture for the week, Matthew 9:35. Jesus went through all the towns and villages, teaching in their synagogues, proclaiming the good news of the kingdom and healing every disease and sickness. Every disease and sickness. So there's nothing too hard for the Lord. Is there anything too hard for the Lord? No, there's nothing too hard for him, because he's capable of healing every disease. So we go to the Father and we pray in the name of Jesus, the healer. He healed all our diseases, yeah? And with that faith, the Lord can do great things for us. So just as he went to others, we can ask now to get that blessing. Okay, just by way of announcement, we do have our residential program start date October 5th to 23rd. Hey, so here we've come to the end of our session. Quite intense. Somebody asking, what is golden milk? It's just simply another way of drinking turmeric. Instead of adding water, you can put it in your almond milk. So you can simmer the turmeric in a little water, and then you can add some almond milk to it. It tastes nice. It tastes really good. Okay, as it relates to supplements, especially the ones you mentioned for brain function, is it okay to take more than one at once, or is it best to do the combination? Let's combine it. You don't have to take it one at a time. You can take them together. It makes a difference. And even look at the lifestyle interventions. When combined, you get better results. So similarly with these herbal agents, when combined, you can combine them. Yeah.
Dr.
Okay.
Nash,
Yes.
how long will the garlic drink last in the refrigerator?
If you're using it, it could last about a week.
Okay,
Yeah.
thank you.
You're welcome. And when I said using it, be consistently using it, for even if it's 2 meals, you do breakfast and you do lunch, you just want to have it at the start of the meal time. Give it a little 15-minute spacing, but you drink that, and it's gonna be helpful. It really helps a lot.
Dr. Nash,
Yes.
I have a question, please. Is Creutzfeldt-Jacobs disease similar to Alzheimer's? And if so, what causes that disease to come on?
Repeat the name of the disease.
Creutzfeldt-Jacobs disease, CJD is the short time for it.
Okay. Right. Mm, let me have a look to give you a good um a good response. Because you're asking. You're asking for. Okay, again, looking for, no. That is a little bit more severe. Right, so that's a little bit more severe, having to do with the parents from, which is a type of protein structure that exists and comes from the consumption of animal foods and particularly even animal brain. So that's a little bit more intense than an Alzheimer's state. That did not, in terms of the causes for Alzheimer's, so that CJB is another type of dementia. And dementia is a result of the disease itself that has impacted the brain. And that tends to just eat away at the brain cells. So whereas with the Alzheimer's, it's a destruction of the brain cells because of the amyloid plaque that exists, because of a gene that exists, because of toxic exposures. So that destroys brain cells and shrinks the brain cell by extension because of the destruction of the cell itself. But the CJB tends to be a little bit, it's altogether different.
Well, is there any cure for it? Or my tongue's getting tied.
Again, it is, once it's in the system, it's in the brain. It's there. The most you can do is sort of like slow down progression for it. But again, and just the cleansers and so forth. So it's going to take a whole lot more effort than the Alzheimer's. But you're asking about cure. I'm not certain. I haven't seen that happen.
Thank you.
You're
Hi,
welcome.
good night. Good night, Doc. I
Hi,
just want to find out, I missed some of the recording. Is it possible for me to get access to it?
yes. So, yes, we do have it up on our YouTube channel. So
Okay.
if you go here to the website, drnatalienash.com, you would see the little YouTube icon, or simply be in YouTube in the search bar and just type it up,
www.
Dr. Natalie Nash, and it would show up, and you would see the sessions are there. This one will be posted as well as all of them. You'd see this picture.
Thank you. Yeah,
You're
thanks so
welcome.
much. Yes.
All right.